Hello friends, welcome to my YouTube channel Nursing Classes, a place where you get all nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम DSSSB नर्सिंग ऑफिसर एग्जाम 28 अगस्त 2019 शिफ्ट 3 का क्वेश्चन देखने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरे YouTube चैनल को सब्सक्राइब नहीं किया है तो प्लीज सब्सक्राइब करें और बेल आइकॉन पे क्लिक करें जैसे कि वीडियो अपलोड होने पर पहले नोटिफिकेशन मिले। और वीडियो अच्छी लगी तो अपने दोस्तों के साथ शेयर करें। चलो अब शुरू करते हैं। 26. Palpation of an olive-shaped mass in the epigastrium is an indication of A. Appendicitis. B. Malabsorption syndrome. C. Ulcerative colitis. D. Hypertrophic pyloric stenosis. Correct answer D. Hypertrophic pyloric stenosis. 27. In order to remember a mobile phone number, one makes it into smaller meaningful units. What is this technique of memory called? A. Rehearsal. B. Chunking. C. Retrieval. D. Relearning. B. Chunking. Correct answer B. Chunking. 28. Identify the type of abortion where the change has progressed to a state from where continuation of the pregnancy becomes impossible. A. Missed abortion. B. Complete abortion. C. Threatened abortion. D. Inevitable abortion. Correct answer D. Inevitable abortion. 29. Which of the following is a cause of secondary postpartum hemorrhage? A. Presence of hematological disorders in the mother. B. Laceration of the lower genital tract. C. Involution of the uterus. D. Presence of retained cotyledons. Correct answer D. Presence of retained cotyledons. 30. On vaginal examination, which level plus 1 station of the fetal head determines the fetal presenting part? A. 1 cm above the iliac crest. B. 1 inch above the symphysis pubis. C. 1 inch below the coccyx. D. 1 cm below the ischial spines. Correct answer D. 1 cm below the ischial spines. 31. In which type of labor, the combined duration of the first and second stage is less than 2 hours? A. Normal labor. B. Prolonged labor. C. Precipitate labor. D. Trial labor. Correct answer C. Precipitate labor. 32. Identify the type of intelligence in which individuals have the ability to control one's body movements and handle objects skillfully. A. Verbal lingual intelligence. B. Musical rhythmic intelligence. C. Body kinesthetic intelligence. D. Visual spastic intelligence. Correct answer C. Body kinesthetic intelligence. 33. Which of the following initial nursing actions has to be taken before performing fundal assessment on a postpartum client? A. Ask the mother to empty her bladder. B. Ask the mother to turn to her side. C. Ask the mother to lie flat on her back with the knees and legs flat and straight. D. Massage the fundus gently before determining the level of the fundus. Correct answer A. Ask the mother to empty her bladder. 34. Identify the immunoglobulin responsible for an anaphylactic type reaction. A. IgG. B. IgE. C. IgM. D. IgA. Correct answer B. IgE. 35. Who discovered the double helix structure of deoxyribonucleic acid? A. Watson and Crick. B. Sir Ronald Ross. C. Louis Pasteur. D. David Baltimore. Correct answer A. Watson and Crick. 36. Which drug is effective for ion chelation therapy in beta thalassemia? A. Dextromethorphan. B. Deferoxamine. C. Immunoglobulins. D. Trimethoprim. Correct answer B. Deferoxamine. 37. Which condition is diagnosed using the Hess test? A. Immunodeficiency syndrome. B. Chronic myeloid leukemia. C. Immune thrombocytopenic purpura. D. Disseminated intravascular coagulation. Correct answer C. Immune thrombocytopenic purpura. 38. What is Biot's respiration? A. Normal breathing followed by periods of apnea. B. Normal breathing pattern with proper rate and rhythm. C. Regular rate and depth of breathing that decreases until dyspnea. D. Increased rate and depth of breathing. Correct answer A. Normal breathing followed by periods of apnea. 39. Which among the following is not a characteristic of Down syndrome? A. Sandal gap. B. Simian crease. C. Pseudohypotelorism. D. Macrocephaly. Correct answer D. Macrocephaly. 40. Which of the following is not related to Dressler syndrome? A. Corticosteroid therapy is used for treatment. B. Fever develops 2 to 3 days after an MI. C. Caused due to antigen-antibody reaction. D. Characterized by pericarditis with effusion and fever. Correct answer B. Fever develops 2 to 3 days after an MI. 41. Which condition is presented by the presence of strawberry tongue? A. Celiac disease. B. Glossitis. C. Kawasaki disease. D. Maple syrup urine disease. Correct answer C. Kawasaki disease. 42. Which of the following categories of children with mental retardation is referred to as a trainable group? A. Moderate mental retardation. B. Mild mental retardation. C. Profound mental retardation. D. Severe mental retardation. Correct answer A. Moderate mental retardation. 43. Which of the following organisms is responsible for genital warts? A. Treponema pallidum. B. Neisseria gonorrhoeae. C. Trichomonas vaginalis. D. Human papillomavirus. Correct answer D. Human papillomavirus. 44. Which food item is advised to be included in the diet of a child with celiac disease? A. Rice. B. Rye. C. Wheat. D. Barley. Correct answer A. Rice. 45. Choose the correct. Correct answer B. Flat, peak wave, prolonged PR interval, widened, QRS complex and tall T, wave. 46. McEwen sign is an important diagnostic feature of which of the following conditions? A. Spina bifida. B. Choanal atresia. C. Hydrocephalus. D. Birth injury. Correct answer C. Hydrocephalus. 47. What is azoturia? A. Excess discharge of nitrogenous matter in feces or urine. B. Excess protein and blood loss in urine. C. Excretion of abnormal quantities of fat in feces. D. Excretion of abnormal quantities of calcium and potassium in urine. Correct answer A. Excess discharge of nitrogenous matter in feces or urine. 48. Identify the type of hypersensitivity in hemolytic anemia. A. Anaphylactic. B. Delayed. C. Cytotoxic. D. Immune complex. Correct answer C. Cytotoxic. 49. How is a Blalock-Taussig shunt performed? A. Anastomosis of the subclavian artery and right pulmonary artery. B. Anastomosis of the superior vena cava and left pulmonary artery. C. Anastomosis of the ascending aorta and right pulmonary artery. D. Anastomosis of the upper descending aorta and left pulmonary artery. Correct answer A. Anastomosis of the subclavian artery and right pulmonary artery. 50. Identify an absolute contraindication for thrombolytic therapy. A. Chest pain longer than 20 minutes. B. ST segment elevation on the ECG. C. Recent administration of nitroglycerine. D. Known bleeding disorder. Correct answer D. Known bleeding disorder. वीडियो कैसा लगा कमेंट करके बताएं और अपने दोस्तों के साथ शेयर करें. Thanks for watching. See you in next videos.